Hi, welcome. My name is Dean Silver, M.D. I'm a integrative physician here in Scottsdale, Arizona. And today we're going to talk about integrative cancer. We have Alec here, and he's going to talk a little bit about his cancer. About a year ago, he developed a testicular cancer, and unfortunately it went to his brain and his lungs. And he's been treated by another big cancer facility at M.D. Anderson, and the results have not been so good. And over the course of a year, he's had 3 craniotomies and received multiple chemotherapies. So Alec is going to tell you now basically what his experience was and how he feels now. And his father's been gracious enough to also talk to us. So Alec, tell us a little bit about what's going on, or how you felt when you came here.
Well, let's see. I had my another brain tumor pop up again. You know, it's been like brain tumor shows up, they try some radiation, brain tumor shows up again, try some surgery, kind of back and forth like that. So, I looked up ozone treatment actually, and that's how I found you. So, contacted you just to see what else is out there.
We're using a new protocol called insulin potentiation therapy, and basically we give Alex some insulin that opens up his cancer cells, and then we're using many different things to get into his brain, and that new occipital lesion completely disappeared. Right?
Yep, that one's gone.
That one's gone. The neurosurgeon saw the other one, and that's all dead tissue. We have his dad here. Let's introduce...
Hi, I'm Gary Stocker, and so Alec has been dealing with this since the beginning of last year, or actually late 2013, and the initial treatment was chemotherapy. Went through 4 rounds. At that time, the cancer was all throughout his lungs. And this was the standard chemotherapy, and that did knock it down significantly, and to the point where upon completion of that, it appeared that everything that was remaining, all the stuff that was showing up in the scans, was dead tissue, based on some biopsies that were done. So as of spring of 2014, it appeared that had gotten knocked out. However, then in July is when it turned up in his brain. Initial scans did not show anything, but then he started having headaches and imbalance issues pretty rapidly around the 4th of July. And so he went in and had emergency surgery. It turned out he had a tumor the size of a tangerine in his brain. That was operated on. Taken out, and then at that time they identified another tumor that was on the other side, but it was pretty small. So after deciding whether to do radiation or figure out what to do with it, in that few weeks time frame, it grew to the point where it needed to be physically taken out also. So he had a second surgery, and then subsequent to that, a tumor popped up in the same original resection cavity where the tangerine-sized tumor was. So that one needed to be taken out. So that was 3 surgeries. And on the third one, there was another tumor that had popped up again, back in a new area that was really a concern. But at that same time, a CT scan showed that there was also tumors recurring in the lungs. So the decision was made just a few months ago to attack the cancer in the lungs with another round of chemo. And at that time was when Alex started seeing Dr. Silver. Dr. Silver took some blood samples, sent them off to a lab that does specific testing for cancer patients, and we were able to identify specific drugs, how they interacted with the cancer that Alec has, and not only chemo type drugs, but natural substances such as vitamin C and curcumin. And so Alec got started on a IV protocol 3 days a week here, and at the same time as starting the second round of chemo through the through the normal chemo process, and a month later went back in to get an MRI to see where the brain tumors that were growing for sure were, and a month later the one that had just popped up that was about about a centimeter, I guess, at that point.
That was in the occipital.
Yeah,
and that had completely disappeared.
That was gone.
Yeah.
And the one in the parietal lobe, that was the bigger one, had shrunk by a third
at that point. So that was a month ago, and then just this past week, Alec had another MRI, and we reviewed that with the brain surgeon, who said that now neither of them are apparent. The one that was shrinking had gone to the point where he didn't consider it a nodule even anymore. It was just remnants from the surgery that had been done.
So the point of this is that we've tailor-made, based on genomic testing, what Alex needs to kill his cancer. We've looked at his genes. We know what you're turned on. We know how to kill it. And we're using specific substances. We use both chemotherapy and both natural things to kill his cancer. And so Alec and I are going to be survivors in this, and we're going to live a long time for this. And obviously, for anybody listening, you need to find somebody where you live that can do this therapy and can tailor-make it to you. Remember, everybody's cancer is different. You need to get cancer stem cell testing. You need to get genomic testing. We've replaced your thyroid levels, your energy levels picked up, and we're giving ozone, ultraviolet, and you're here most of the day, right?
Yeah.
Most of the day. But we're gonna win this battle. And he's cleaned up his act. He
cut out sugar completely.
Eating coconut oil and being a good boy.
Yeah.
So for anybody listening, that's my cancer therapy. You can look me up in the World Wide Web at www.deansilvermd.com, or you can call me at 480-860-2030. Thanks, guys. Thank you. Thank you for, I think what we're trying to do here is help some other people.
Yeah.
Thank you. Bye-bye.